welcome back. I'm Jasmine with IPS Learning Institute, helping to improve the delivery of patient care by alleviating the stress and confusion on the business side of healthcare. Today, we are talking about eligibility. A lot of terms that get bounced around in the area of eligibility really stem around two different terms. So one that's benefit verification or eligibility of benefits, or VOBs, which stands for verification of benefits, or coverage, or eligibility, or check for coverage, or checks for benefits. All these various terms that kind of get bounced around, they essentially mean the same thing. So what we're looking for is information on the patient's benefit plan. So some more detailed information would be the benefit verification piece. The eligibility piece is more simplified, that says, is the patient eligible? Are they even covered by that plan? Okay, so think of it like a hierarchy that says the coverage, the very basics of eligibility, is one portion, and then you go deeper, you look under the hood, you go deeper down that ladder and say, I need to go deeper and find out what exactly is covered, which is really opening up the patient benefits to say, okay, I need a specific line of benefit or service that I believe I'm going to perform in my practice or organization. So we talk about these two different pieces. There's ways that we can go about verifying eligibility and then getting more detailed information. Okay, so the top 5 ways that we really see folks doing this today is through websites such as direct to payer, so insurance company direct website. So if you have your local Blue Cross Blue Shield, or you're a provider for Aetna or United Healthcare, you could go directly to those payer sites or the primary resource that they use for those sites. Some insurance companies these days have replaced their provider website or provider resource with tools such as Availity and Navinet. Those are more centralized solutions, which is our next way that folks are looking for benefits and eligibility checking. So going directly to a resource that covers multiple payers, so not just one payer, but maybe 5, 6, 10 payers underneath that same umbrella or that same portal. So you can go directly to that payer resource, such as Availity, Navinet. Those two are probably the most popular, the most utilized at this point in time. We're in 2020 now. So keep in mind that they cover more than just getting your one payer resource. Now, in order to access both the payer website and your these other more the larger scope resources such as Availity and Navinet, you're going to have to make sure that you are enrolled with the plan, number one. And then you're also going to need to make sure you register with this tool. And sometimes that registration direct to payer can take time. So it is pretty seamless once you're in Availity to add additional payers to access to the system. So it might be a better solution if you have a number of insurance payers that you participate with for you to utilize a solution such as Availity. The third way is directly through your clearinghouse. So if you have an insurance clearinghouse, a claims clearinghouse to submit your claims to an insurance company, likely your clearinghouse has some sort of eligibility verification tool. So it may not go as deep as to give you full detailed benefits, or maybe allow you to search for a service level benefit, those kinds of things, but you certainly will get just at least the basics of what you need for eligibility checking. So it's important to know that when you are utilizing a clearinghouse, there's really 2 ways that could happen. It might be a tool that's integrated directly in your software. So your practice management system might already have a tool built in that can check that patient's eligibility even prior to their visit, or you can be able to call an eligibility check on a more manual basis, or a batch for a number of patients at once. Okay, so there is an opportunity for you to utilize this integrated eligibility tool to help improve the way that you serve your patients as well. So that is something to think about, how some of these tools allow your schedule to be matched and attached directly to this eligibility tool, in which case you can have it automatically checking 24 hours in advance of a patient's appointment or even 48 hours to give you adequate time to reach out to the patient to let them know if the insurance information is not updated or it needs to be replaced with some more up-to-date information. Those kinds of things. So basically, when you have an integrated tool, you have a little bit more, you have a bit more benefits to utilizing a tool like that versus needing to manually go out to a payer site or to an external tool. So there are ways for you to use a system that is outside of your software to benefit you as well. So if the patient walks into your clinic and you do not have the insurance information in advance of the appointment, that is very helpful because it allows you to be able to do what we call real-time eligibility checking, which can happen directly through payer, through your clearinghouse in some instances, and through the centralized systems like Availity. So you can certainly benefit from utilizing these real-time tools, because if you have that patient that just walked in and you have a batch eligibility system, you don't want that to fall through the cracks now, not be able to check eligibility. So going directly to a tool that lets you call that eligibility check and immediately get a response back is going to help. Okay, so our second to last way that people can check eligibility is probably the bottom of the list, or very near the bottom of the list, is going to be calling through the IVR. So the interactive voice response system, which is the automated system when you reach out to an insurance company. It often will go through a certain line of questioning to be able to confirm information with you so that you can get just the basics of that patient's eligibility and potentially some more detailed information. So the very last on the list is talking to a human at an insurance company. And it's last on the list because it takes an enormous amount of time these days. Hold times are incredibly long right now with insurance companies, and it just has been increasing over the months and years. So just keep in mind that is going to fall at the very bottom of the list. You don't want to have your staff consuming a lot of hours of their day to sit on hold waiting for an individual. So that is one reason why it's very important to inform your patients that you get an estimation of benefits. You may not get very detailed information from those IVR systems or even from the website tools that we discussed earlier. So it's really, really important to notify your patient. This is just an estimate. This is not a guarantee of benefits. Throw that same disclaimer that the insurance companies throw at us. Go ahead and let the patient know the same thing, that we are going to have to submit your claim, allow it to go through processing to know exactly what your responsibilities are if you have some additional non-covered services. Okay. And so keep that in mind. Again, we're not talking about, we're not talking about Medicare here. We're talking about other commercial payers. So there are some limitations on non-covered services and ABNs, advanced beneficiary notices. So we'll talk about that at a later date. If we're talking about all these other commercial carriers, you want to make sure the patients are aware that you are getting a quote of benefits that the insurance company is providing to you, and it may not be as detailed as needed. And it's also going to require that these insurance companies review the diagnoses and all of the considerations included on your claim when they receive it in order to confirm that benefits are payable. Okay, so what are the things that they need for eligibility checking or verifications? Bare minimum, you're going to need that patient's name. You're going to need their date of birth, the ID, that is the insurance ID or member subscriber number. So those three things are going to be the absolute necessary pieces. If you are looking to verify benefits for a specific service, you may also need that procedure code, the CPT or HCPCS code, and you may also be required to provide a diagnosis code. And so those are likely more commonly required for things like surgical procedures, right? So if you are looking to verify for that specific line of service line or procedure that your clinic is looking to offer to a patient, or you're going to want to make sure you have at least those last two things, so the diagnosis and the procedure code as well. Okay, so that is it. Thank you guys so much, and I look forward to seeing you next time. If you found this video helpful, give it a thumbs up. And if you're new here, welcome. We post videos each and every week. So don't forget to subscribe and hit the little bell so you don't miss out on videos that will help strengthen your knowledge and the business side of healthcare. Until next time, my friends.